All right, so this is our health and safety perspectives panel, and we get to hear from three of our best partners that we really just love working with. And so we're going to hear from Lori Montserrat, and she is the Senior Environmental Scientist for the California Office of Environmental Health Hazard Assessment. She has been working with tribes really closely here in California. And then we're going to hear from Osamu Kumasaka, and he is the Tribal Climate Change Program and Policy Specialist at the California Department of Public Health. And we've been working really closely with him too. He's two folks here in California, but we also have somebody on the federal level. So we've got Claudia Langford Brown, MD. She's a health scientist with the CDC. And she is somebody who's been really helpful on the federal side of things. And all of these folks have great experience to share with you. The whole purpose behind this panel is to share what they're learning in their work with tribes, sort of a 50,000 foot level view of what they see happening around the country in terms of tribes and climate change. So with that, I'm going to first introduce Lori for her presentation. We'll do short presentations, and then we're going to do a set of moderated questions with discussion and Q&A. All right, take it away, Lori.
Cool. Hi, everybody. I'm Lori Montserrat. I work with the state of California for the Office of Environmental Health Hazard Assessment, which we lovingly call WEHA. I work, can you hit the next slide for me, please? I work with California tribes and other collaborators on this Indicators of Climate Change in California report. It's a periodic report. It comes out about every 4-ish years, and it is a snapshot in time. We don't project what's going to happen. We just give you a picture of what is happening at the current time. And we have historically broken these indicators out into little discrete pieces, like greenhouse gas, and trying to look at greenhouse gas and nothing else. Pine forest retreat, where the forests are moving to higher elevations in search of cooler climates and more moisture. And my personal favorite, the navel orange worm. So these are tiny little indicators. And this go around, which is the first time we've done it, we're working with California tribes. Can you go to the next slide, please? And in doing so, we needed to come up with some principles and ideas for working with tribes. And that is, if a tribe says it, it's their information. We can only share it with their permission, and they can withdraw that permission at any time. So in all of our listening sessions, in all of our one-on-one tribal collaborations, no matter what information we get about a tribe, so Bishop Paiute, for example, we may do research on their behalf. They can give us research. We could get to the very end, and their tribal council could say, hey, we don't want to share any of this. And that's it. That's the end of the story. We don't beg. We don't share it anyway. It's the tribe's information, and that's the end of the story. And so that's been really important to us in our work with tribes. And I think it's something that governments should insist on. It shouldn't be up to the tribes to beg us to handle their data respectfully. It should be up to us to treat the tribe like I would treat Canada or France, respectfully. It's their information. It's not mine. That's just the way it goes. You can go to the next slide, please. So we worked with 8 individual tribes, and we don't care if a tribe is federally recognized or not. It doesn't matter to us. We're a state agency. And then we had listening sessions in the Eastern Sierras, Southern California, and Lake Mendocino and Sonoma counties. And yes, that's not even close to all of California. And we know it. When we started this process, and it's good we're remote because nobody can throw things. when we started this process, our idea before we talked to tribes was, I know we'll go to the tribes, we'll ask them for all of their information. There will be an information giver at these tribes. They'll give it all to us. We will validate their knowledge with our Western science. Possibly a child will be named in our honor, and we'll go about our business. We quickly learned that we were full of beans, and that's not the way we ended up doing things, thankfully. So this is, we've changed, my boss has changed, and I would say our department has changed as a result of working with tribes, and I think we're far better for it. All of these reports are going to come out. It was supposed to be already out, but they'll be out in August or September. I do have permission to share all of the tribal specific reports from the tribes. So if anybody is interested in a sneak preview, drop me an email and I'm happy to provide that to you. And the listening session reports are all available on our website right now. Next slide, please. So my favorite resources in climate change work, my number one favorite resource is you. I was working with a friend of mine who died last year, Harry Williams, who was a Bishop Hite member. And it was when I was starting this process, and I met and I asked him for data, and he said, oh, how far back do your data resources go? And I was pretty excited. And I said, some of them go back over 100 years. And Harry said, so you wouldn't want information from like my grandfather, because that's way more than 100 years, or my great grandfather, or my ancestors before then. You won't want that information because that's not going to match with your Western science, right? And, I'm slow, but I'm not that slow. So I realized that, the tribes have much more information than we do. Talk to your elders if they're willing to talk to you. Listen to the people, look around, take a walk with people on your lands, and see what they have to say, because that's going to be your deepest source of information. Our website, of course, I think it's fabulous. We have these technical reports on climate change that cover all sorts of things: heat, wind, lightning, subsidence, anything you can think of. CalAdapt will give you projections for climate change, which is nice. My favorite tool in the world is PRISM. It's through University of Oregon, and it's for precipitation and temperature data. It's so easy to use. And if anybody wants a one-on-one tutorial, I will be happy to give it to you. It's great. And the easy tool, it's a great tool, but it's scary because you open it up and there's this tiny font and it's overwhelming. And so I close it right away, and then I open it again and calm down and use it. Next slide, please. And State Climate Tracker, it draws from PRISM, so I think PRISM's better. Palmer Drought, the US Drought Monitor, and NOAA's Sea Level Rise Viewer are also really great. And these are links for all of them, and you guys will get the slides. Thank you so much. I appreciate all the work you're doing. And if anybody seriously needs help with anything, let me know. I'll be happy to help. Thanks. Bye.
Thank you, Lori. You should join us for our data little breakout and lunch, unless you'd like an actual break, but it would be great to have you. All right, so next up, we've got Osamo with CDPH out here in California again. So take it away.
Great. I don't know if I'll be as concise as Lori, so apologies. Just let me know if I'm running a little long. Yate Abine, everybody. My name is Osamu Kumasaka. I use he, him pronouns, and I serve as the Tribal Climate Change Program and Policy Specialist for the California Department of Public Health's Climate Change and Health Equity section in the Office of Health Equity. I know that is a big mouthful, but the long and short of it is that my position is to provide technical assistance to tribes with climate health planning. I am speaking to you today from Huichin territory, the ancestral and unceded land of the Chochenyo speaking Ohlone people in Oakland, California. And I introduced myself in Navajo because I am not native, but grew up on the Navajo Nation in Chinle, Arizona. My professional background is in urban and environmental planning, and I've been working to try to bring that skill set to a couple different tribes that I've had the pleasure of working with over the last year or so since I started in this position. And so today I'm just going to share a little bit about what our section at the Department of Public Health does. We're a small but mighty team of 7 staff who focus on upstream policies, systems, and environmental change to make sure that California's actions to prevent and prepare for climate change improve health equity in the process. This job of providing technical assistance with planning to tribes is a new duty for both myself and our team as a whole, although in prior roles, I've supported tribal nations in Louisiana, Alaska, Hawaii, and Massachusetts with climate change related planning. So here you can see that the spectrum of ways that climate change is harming human health. We talked a lot yesterday about seeing more frequent and destructive wildfires, like the massive ones that burned through Northern California last year, scorching heat waves, and the ongoing severe drought. And in addition to the severe physical health impacts, the mental health harms are often greater and can even be longer lasting. So this graphic is one that we use to show that full spectrum of impacts. And our office emphasizes how climate-related health effects are usually felt first and worst by those already facing social inequities, including those without housing, low-wage outdoor workers, communities of color, those who are socially isolated, and people with physical and mental disabilities. Next slide, please. The destructive effects of climate change are likely to fall disproportionately on communities that are already disadvantaged by historic and current social, economic, and political oppression, such as Native Americans, because the public health effects of the climate crisis are exacerbated, made worse by structural racism. We use a racial equity lens for climate change work. This lens is about achieving a fair distribution of power and access to resources, which requires prioritized investment and opportunities in and for communities facing historical and continuing injustices, which can then reduce vulnerability to harm from climate change. So I'll share a couple of tools that we use in just a second to try to achieve a more fair distribution of resources based on injustice. Next slide, please. I don't think I need to go into too much depth about this, but tribes, as you know, have already faced disruptions on the scale of climate change before in surviving attempted genocide, land dispossession, and forced migration. Indigenous nations across the US have lost nearly 99% of their historical land base over time. And I'd like to share a study from last year that determined that tribes were by and large displaced to areas that are currently more exposed to a wide variety of climate change risks than the lands from which they were displaced. So due to structural racism, colonialism, and ongoing disinvestment, many Native American communities are more likely to be living in poverty, which is a risk factor for declines in physical and mental health, housing insecurity, and houselessness. People living in these kinds of conditions have a harder time adapting to environmental changes. Those who are unhoused have the added burden of seeking safe shelter during extreme weather events. And by and large, Native populations and tribal nations face the destructive effects of climate change with less resources to respond to those effects. For example, American Indian and Alaska Native folks have long had the least access to running water and electricity of any demographic. People without access to utilities and air conditioning are at increased risk for hospitalization and death during heat waves, for example. And I just wanted to talk briefly about how recently the COVID-19 pandemic, particularly in the early months, revealed how many tribes suffer from infrastructure gaps, underfunded healthcare systems, data deficits, low staff capacity, and may lack the sovereignty needed to lead emergency response and recovery efforts, which we heard a little bit about yesterday.
And Samu, I'm just giving you a little time check. You got a couple minutes left. We're going to have a lot more time with you in moderated discussion.
Okay, great. Let's skip ahead then. Next slide, please. These are just a few of the kinds of plans and policies that my team informs and tries to bring a health equity lens to. In particular, I just want to, next slide, share that the updated climate adaptation strategy for the state, which was released last month, very prominently features the wisdom of tribal input, which we hope will result in concrete improvements for tribes in California. Next slide, please. Our team does a variety of activities to try to increase the capacity of local health departments and tribes, including working on the CalBRACE program, California Building Resilience Against Climate Effects, which we collaborate on with the Tribal Climate Health Project, Angie and Shasta and their teams. And the goal really of this framework of CalBRACE is to help tribes lead planning initiatives and partner with local health departments to bring a health focus to climate adaptation planning. A secondary goal is to help tribes access the billions of dollars that the state has allocated for climate related projects and planning. Next slide, please. These are just a sampling of the different kinds of climate-related funding that tribes, many of which have tribal carve-outs and are working to try to increase tribal access by hiring technical assistance providers. And so I've tried to connect the tribes that I work with to these different funding resources. Next slide, please. I'm happy to talk more with anybody who's interested about those funding opportunities. Another thing our team does is we hold a semi-quarterly public health work group of the climate action team. And I just wanted to use this opportunity to invite folks who are interested in the kind of California programs to our next meeting on August 30th, which will focus on tribal climate and health planning. Next slide, please. We have two different tools that I like to point people towards. So they're both mapping tools that show climate change vulnerability for either counties or census tracts. So the first is our climate change and health vulnerability indicators for California tool. Next slide, please. And you can see what that shows when you select a county. So you can see it a variety of different sensitivity, exposure, and adaptive capacity indicators for your area as compared to the rest of the state. Next slide. We've also got, we've helped develop or inform the Healthy Places Index for California, which also has an extreme heat edition that I just wanted to show here that I'll provide a link to. This is another really powerful tool for data visualization, which you can use for your plans. And I'd encourage you to do so because they've pulled all this different data together for you to use. Next slide, please. Finally, I just wanted to end with a couple remarks about the learnings that I've done working with tribes, two different tribes over the past year or so, the Mono Lake Kutsadika tribe and Redwood Valley Rancheria. They are both working on fairly similar health vulnerability assessments and climate adaptation planning processes, which we learned about yesterday. I've supported Mono Lake in applying for state climate grant programs, and they were actually profiled in the local paper for their planning process, which is helping raise their profile to support them gaining federal recognition. With Redwood Valley Rancheria, we are working on a health data request in coordination with the California Tribal Epidemiology Center to give them population sensitivity information for their study area for their vulnerability assessment. And this is a cool collaboration that I'm hoping we'll be able to duplicate in the future. Next slide, please. So this is my last slide, and I just wanted to share some of the things that I think we've learned supporting these two tribes over the last 6 to 8 months. So I would just say, and this is really reflecting on what Angie was sharing yesterday about the planning process, but we found that tribal staff, had to get permissions and buy-in from council or tribal chairpersons, and it was helpful to try to find alignment with their existing goals, like federal recognition or strengthening tribal sovereignty over land and resource management. For the braided approach that Angie discussed, we really, had to do active outreach to try to reach out to other tribal members, elders, tribal youth, and other departments to get input and participation. In particular, I will say that breaking down the kind of silos between the environmental departments and the health officers or health clinics has been a challenge, and I think is not a collaboration that these departments are used to. And so I'd encourage you to be bold in your outreach, to try to tap people who maybe you haven't worked with before. We had some challenges with defining tribal boundary areas for the studies, which I'm happy to talk more about. And then currently, we are testing different strategies for engaging what's often, a very remote and dispersed population for California tribes, including surveying. We're adapting the survey content that the Tribal Climate Health Project provides to kind of make the language more culturally appropriate. So, for example, the phrase environmental assets didn't really resonate with Mono Lake elders, who I think more of Mother Earth as our responsibility to steward and not just kind of an extractive natural resource. And then finally, we're learning that, tribes have limited planning capacity, and doing this kind of adaptation plan and also applying for state and federal grants might not be possible. So you have to kind of figure out what your priorities are and what your timeline is. So that's some reflections, and I'm looking forward to discussing more about the nitty-gritty of how to do these kind of plans. Thank you. Yeah.
Thanks, Samu. So we're so lucky, yes, we're talking a lot about California. I wanted to share some examples of how it looks for a state agency to be really trying to work with tribes in this way on climate change and providing some very useful support. We're really lucky here in California with the data and the folks that we have access to, but some of the stuff is very applicable to some of you across the country. So Samu and Lori, could you drop, and I think Lori already did it, some links in the chat for folks to take a look at what the state of California is doing? Some of it translates. All right, so next up, we've got Claudia Brown, and she's the health scientist with the Climate and Health Program Division of the Environmental Health Science and Practice at the CDC. So Claudia, take it away. Thanks so much. You've got about 8 minutes, then we're going to move to moderated questions.
Sure. Thanks, Angie. So happy to be here, honored to be here and participate in this. And I feel a little, awkward feeling like I'm on an expert panel, and I do feel like I'm learning more from this event than I feel like I'm giving, but happy to be here and share what knowledge I can, but also most excited to hear from you all and what's going on. So next slide. So this is a similar graphic to what Samu showed, but I think this really exemplifies why climate change is a public health issue and a priority at the Centers for Disease Control and Prevention. It seems like it froze on my side. Maybe give it another click. there it goes, is going to keep going and expand from there. But as we've discussed, with the changes in temperature and precipitation, we're seeing changes in the environment and the balance between in the changes in the weather and weather systems, changes in air pollution from wildfire smoke, and also emissions, changes in vector ecology as we're seeing winters become shorter and the season for vectors like ticks and mosquitoes shifting to be earlier and longer. Same for phenology, plant phenology, which is something we talked a lot about yesterday, but seeing the shift in the season as allergenic plants are producing pollen earlier in the season and have a longer pollen season and a more intense pollen season with increases in carbon dioxide. Changes in water supply and quality, and then of course, extreme weather events and general environmental degradation. And all of these have health impacts. They have direct and indirect impacts on things such as allergies and asthma, cardiovascular disease, and failure in some instances, and even, general disruption in mental and physical health and well-being. And we've talked some about the economic impacts and how that can be affected by climate change and really hit households deeply. So from the CDC's perspective, this is considered a top priority from the director down, and even at this point from the president down. So yeah, I'll talk a little bit about what we're doing in the next slide. Well, actually, I was going to mention, so you can click through, I think it's about 3 clicks. So climate change does not affect everyone equally. As we've talked about, every region of the US is experiencing different climate threats and stressors to their communities. And then also, how it affects someone depends on what they may be sensitive to based on pre-existing physical or mental health conditions, as well as environmental conditions, housing, and roads and infrastructure. And then another component that's important to understand when talking about climate vulnerability is capacity to adapt. So the resources and the infrastructure in place to respond to the changes and as a result of climate change. Next slide. So the CDC's Climate and Health Program aims to do a few things. First, serve as a resources for federal, state, local, and tribal health agencies. So we're working really across the board at a national level, providing these general resources that can help public health practitioners and leaders in communities to address the health effects of climate change. I'll be talking about some of the tools and guidance and documents that can help in this process, but something that's important to consider is that these are purely frameworks and guides, and they're really meant to be used as a tool and not necessarily like a recipe, and be something that can help to facilitate climate adaptation. Next slide. And so we do this by providing funding, and these are some of the grant recipients for our program over the last 10 years. You'll see that we have been able to provide funding at a state level and at a city level, and to tribes and territories through tribes, specifically through the National Indian Health Board's initiative called the Climate Ready Tribes Initiative. Next slide. So the CDC in general is using a framework to address climate adaptation. It's called the BRACE framework, Building Resilience Against Climate Effects. And in general, it's a 5-step process that's meant to be, again, a framework, something to use as it is best for the community and what they have based on what they have in place or need. But in general, the steps are that you anticipate how is climate change affecting your area, and what are some of the current conditions like physical and mental health conditions, environmental conditions that may make your community more or less susceptible to those impacts. Then it's projecting or looking into the future. So how is climate change going to affect health in the future? Is it going to exacerbate some of these current conditions, or are new health conditions going to be emerging? That third step is assessing what public health interventions there are, what options there are, and what resources are in your community that can be leveraged for implementing and would make certain interventions appropriate. And then that fourth step is actually engaging with the stakeholders, having a plan around who's responsible for what, and coming up with a climate and health adaptation plan. And then that last step is critical. It's evaluating the impact of the actions that have been taken to assess, was it effective, what could be improved, so that this is considered an iterative process, as climate change is fluid, and how it affects communities is always, we're always learning new things, and this is an opportunity to assess how is your climate adaptation plan working, and how can it be improved. Next slide. So I mentioned we have some guidance documents. These are just a few around how to do or assess health vulnerability to climate change, assess projecting the disease burden in your community, and then also do some guidance around climate projections. Next slide. And I'll be talking during the data workshop about some of our tools, but we have some various data and tools available, all open to the public on our website for anyone that would like to use them. There's also some trainings and videos and webinars, and even social media toolkits and things that can be used, as you see fit. Next slide. Okay, so if you want to check it out, that's our website, just cdc.gov/climate and health. And you can see all of these resources. And also you can reach out if you would like any help or technical assistance. We're available for that. Next slide. Okay, and thank you. That's the email address for our program.
Thank you so much, Claudia. If you would drop any of that in the chat so folks have an easy time linking, that would be really great. I love the CDC, and I invite all three of these speakers to join me for our, I'm just going to call it what it is. It's going to be a tool nerd out breakout session at lunch. So if you are interested in learning more about any of these tools, don't stress. There's going to be there's still a lot coming at you today. The amount of resources is overwhelming. That's part of the reason why we created the easy tools, sort of like a place, an umbrella to contain them. But we're going to talk more about it, and you have ways to find it again. Okay, so now we get to talk. Oh, we're not quite there. We'll go back. We're going to do a moderated conversation now, and I want to encourage folks in the audience, drop those questions into the chat so we make sure we can address them by the end here. But I've got a couple questions for our panel. And so the first one is just sort of from your experience, how would you characterize why it's so important that tribes sort of proactively include health in their climate vulnerability assessments, or what happens if they don't? Anybody can start.
Well, I'll jump in and get us started, but it's so critical to assess the health vulnerability to climate change as, we're hoping to not respond to climate change, but to prepare for climate change. The response is, in public health, we talk about this a lot, but response is much more expensive. It's a lot more deaths and illness as a result if you're not prepared. So it's super critical that you get ahead of it and it's going to benefit your community all the way around. So, when doing these vulnerability assessments, if you're not considering that health component, you're really not getting a full picture of what the impacts of climate change are. You can look at the economics, you can look at agriculture and these different things, but at the end of the day, what is important and to us is how is it going to be affecting the people, and who disproportionately. I think Osama really got to this, but who's being hit first and worst, so that you can target your resources into specific, and use them more efficiently and effectively. So all of that, if I can do more of a pitch, I'm sure Osama and Lori can help me out here, but it's so critical to doing this work.
Say that you're doing it whether you know it or not. The health of the environment and the health of the tribe are tied together. So you're already including health. Why not do it directly and make it clear to everybody?
Yeah, I mean, I don't want to be too dramatic about it, but I do feel that by failing to put human health first, we are risking more people dying. I mean, frankly, that's what it means at the end of the day. When you look at past hurricanes, past wildfires, the kinds of mortalities that we see, it's by and large, it's the elderly, it's people with disabilities who have a hard time evacuating. So, and that's just the direct exposure, and heat waves as well. We see isolated elders tend to be the kinds of folks who will perish in these events. And so I think it's of the utmost importance. And it's something that I think comes very naturally to many tribes, because the connection between environmental health and our personal health is part of belief systems. But I do, Andy, you're saying there's a lot of tools out there. And I will say the two that I presented, which have health front and center, were, not just to brag for a second, were ranked the best out of more than 40 that the Asian Progressive Environmental Network looked at for California. So there are a lot of indicators. They're varying in quality, they're varying in the kinds of data that they use, but there are some that are better than others. And I would encourage folks to use some that have already pulled the health data for you, so you don't have to do that really technical work. You can actually, lean on the many people who have applied their brains to this already.
Yeah. Thanks, guys. I've seen a lot of vulnerability assessments or adaptation plans that stop at the exposure level. Say, yeah, we know. Here's how bad wildfire is. Here's how bad even drought, water insecurity. They kind of get down. But then there's a leap of faith that has to happen to really understand how it's going to affect the people. And so it's this concerted effort to really get specific about those impacts. And if you don't, you have those blind spots. It's really hard to act. So I think we all agree. Thank you for that perspective. What's the most important thing, and some of you kind of touched on it already, that you've learned in your work with tribes about how to protect health and safety, and how has it changed your approach in your own work? And maybe we could start the opposite direction. Do you want to start, Samu?
Yeah, tough question. I think, so I'll just share, I guess, a little bit from my experience working with tribes in the Gulf Coast, because I don't know if we're quite gotten to the point of figuring things out with the tribes in California that I support. But I have learned that there are, a lot of the times there's either been too much research and too much outsiders coming in and into the tribes. And so people feel fatigued, right, by all of these past planning efforts. So in Ile de Jean Charles, for example, the tribe we were working with, they're famous, I think, really for the hurricanes that have come through and how they're doing this community relocation together, but they're exhausted. They have been studied and poked and prodded to death. And I think it has really affected people's, energy levels and ability to do this, actually do the relocation and think about, how they can really make that a good experience for themselves. And it's really sad. And then on the other hand, I think there's many tribes that have basically received no assistance to date. And so there's this real void of plans and capacity to build on and funding to build on. So you're coming in, you might be starting your assessment and your adaptation plan with really no existing team to work with. And so you really have to do that work of kind of, taking stock of all of the different resources available to you and the people who might be able to help out. And I think that can be a very exciting process, but it also can be very frustrating because everybody is so at capacity, especially during the COVID pandemic. We'll stop there.
Thank you. Anybody else want to jump in on that question?
Yeah, the most important thing I've learned is to listen to the tribes and to hear what their needs are and to hear how they may need help to protect health and safety or to do a look at health and safety in terms of a vulnerability assessment. If I swoop into the Owens Valley and offer flood protection information, that's not really going to help them. So listen first, then help.
I was going to say something similar, Lori, that, something I've learned and you all are very well aware of, but the tribes have been doing this work much longer and at a much deeper level than we have been. And there's a lot to learn from and to listen. And I think opportunities like this and other listening sessions are really critical for, and I'm taking lots of notes and learning a lot from this and taking it back and trying to play my role and elevating the voices to CDC on my side. But more opportunities from this would are just so critical and important, and something I value and would like to see more valued as well.
So we're going to get to folks in the audience in just a moment. We've got a couple more moderated questions. So here's the next one. What gaps are you seeing tribes bring up that are not being filled by either your agency or others? Meaning they're telling you their needs. What work is left to do? Anybody can start.
I can think of a lot. First of all, and something that your group, Angie, has really raised in these data work group calls that we have, but we don't have data at the tribal level. We have, county level, census tract level. I've taken it to the Environmental Public Health Tracking Network. Why don't we have this at this scale? And they don't have a great answer. Oh yeah, we wanted to do that. We'll get to it, or it just hasn't happened yet, which isn't a good answer. But that's something that I think is critical for better having more information and also justifying the need for more resources in this. So for me, that's for the forefront, and I work in data and climate health data. So that's on my mind of a critical gap and need is more of these more relevant scale of information.
I'd say, I don't know if it's exactly a gap, but I'm seeing that the state and feds offering grants and help, and those grants and help come with waivers of tribal sovereignty. And I really think that's a non-starter for many tribes. And so I think if the government or anybody else is offering to help, that we need to offer the help the tribes want, not the help that we want to give.
I'd be really interested in anybody in the audience who's had good experiences working with a state or federal agency that's not requiring a waiver of sovereign immunity. Drop that in the chat or raise your hand in a minute. Okay, Well, let's go to our last our last question. So what are the key challenges you've seen for tribes that want to do climate and health vulnerability assessments, and how have you helped them work through it? It's a similar question. I think maybe you all sort of touched on it, but any final thoughts there?
I guess I'll add, we CDC Climate Health Program put a lot of emphasis on our Building Resilience Against Climate Effects framework, and have also acknowledged that there's a lot of limitations and what, and how that can be implemented. It requires, a lot of resources, a lot of expertise, a lot of capacity. That, we're glad California can do that at the state level, but can that, realistically be done at a more local level? Probably not. So, one thing that we've talked a lot about is adapting brace, and providing different alternatives for implementation, with less need for data analysis or those types of resources. And something else that we're working on at CDC is providing tools that are doing the data processing on our side, so that it's already, we have the relevant indicators and it at the right level and all of that. So it's easy to kind of pull that information, and it's making that data more accessible and more usable, to at the community level.
Yeah, I'd say another big is just the number of jobs that an environmental director with a tribe has to do. I was working at a tribal environmental director's office on the report, and somebody came in that had pulled up a bunch of tule reeds, so they needed to be planted right away. So we stopped our work to go plant those tule reeds. Then an elder came by the office who didn't have food, so we had to go get that person food. And then we went back to working, and then somebody showed up in the office with artifacts that had to be dealt with. And so, this is the same environmental director that's doing this vulnerability assessment and all these other things. And I don't think as state and federal agencies, we normally understand what busy is until you've worked with a tribe.
Right.
I think from where I'm sitting, and I talked about this a little bit, but there's just so much funding, so much funding that the state of California is throwing at climate change via, I think, 70 plus different grant programs, and like a cumulative $10.5 billion that have been spent from the cap and trade programs revenue. And I really want tribes to be able to access that funding and to be able to increase their capacity by hiring more staff and providing local jobs even. I mean, that's what we're starting to see with some of our tribal environmental departments is they're, if you can get the grant, then you can hire more staff and then it can kind of go from there. But even that initial, like getting that initial grant to really get off the ground is such a big lift. And so what I wonder with the BRACE framework, the CDC framework, is how can that do double duty, that you're writing this plan, but then you can copy and paste that as background for, going and getting a hazard mitigation grant, going and getting a state adaptation grant. Like I really think we shouldn't have people needlessly working and writing if it's not actually going to result in material resources, so that you can have more staff and you can keep doing the things that you need to do as a tribal health officer. So yeah, I think that is
appreciate all that. Yeah, it's like you guys are my kindred spirits in capacity building and trying to think through how can we possibly help from the outside. So I really appreciate all these thoughts. I'm going to give some time now to the audience questions. I want to make sure we have a little time for that. And Elroy, I see your hand up. I'm going to get to you next. I'm going to take a couple of the questions from the chat. So there are many, Geraldine is saying there are many resources and guides, but how can we help jumpstart or guide the trainees to apply what they learn? Yeah, that's the $1 million question. Anybody got an answer?
Shasta answered it in the chat.
Oh, you did. Tell us what you said.
Start.
What?
Start, just start.
Which one? Yeah, yes, just start. I found that my experience was a lot of just feeling frozen, like, what do I do? You're giving me so much information. Everybody's going to have a different process that works for them. I find that if I've got even just like a list, sort of like what you went over yesterday, Angie, with the vulnerability assessment, so step 1, talk to your community, pick one of those things and just start doing it. Step 2, brainstorm your own ideas, what you think the vulnerabilities are. And we did that yesterday as well. Step 3, if there's somebody else in your office who's working on this, or, a trusted person in your community, ask them for their advice. But it just, what's that cliche? The journey of a million miles starts with a single step, or it's 1,000 miles. Sorry, I just made it a lot harder. But just, yeah, my mom is teaching me how to play mahjong, and I'm very confused when she just tells me what the rules are. But as soon as I start putting my hands on the tiles, suddenly I start to understand how to play mahjong, and this is the same. Oh, Elroy says he has to jump off. Are you gone already, Elroy?
Oh no, we lost him.
Well, we'll have time to bring him in when he comes back.
I think there's some really good comments here happening in the chat. We've been raised to care for our environment and as would our elders, whether they be trees, plants, fish, or wildlife in our environment. Who are we? Okay, let's see. Maybe somebody else can help me. Is there any other questions, specific questions in here I can pull?
I saw a question about so how can we address these issues, and then do we and how do we get support to sustain these adaptation plans? So a few thoughts on that. One, I think there is a lot of information out there on like different interventions, and whether they work or not is another question. There is more work being done on that. I know on our side, we're really encouraging our grant recipients to focus on evaluating the adaptations they're doing to kind of build a best practice evidence base. But I think, making these sustainable, one critical piece in that, I think, is engaging the strategic planning already going on in your community. That's something that's happening. And is climate change being considered? So, having a strategic plan for the community and then a climate adaptation plan that's separate is not really effective. Those really need to be integrated to support one another and leverage the resources and the stakeholders and all of the work that's going into these other plans, and make sure that climate change and health is being considered. That's the best way to, I think, most effectively use the network and the strategic, planning efforts that are already underway, to make this really something that is sustained and has everybody on board.
And Angie, if I could, I want to comment on a comment, because the chat's just been great, from Dennis Longknife, about how their tribal health service is not really interested in engaging with them on the climate stuff. And what did you say, Dennis? That you drive them crazy, but you make them talk to you anyway. To that point, there are always going to be people, and Ryan brought this up too, who don't think climate change is a problem. So you know what? Don't even say climate change. All you need to do is talk to people about what these issues are that are affecting their lives, their loved ones' lives, their community's health. So if climate change means that more ticks that you didn't used to have are coming in and bringing in diseases you didn't used to have, you don't have to say it's because of climate change. Just say, guess what? We have Lyme disease now, and this is what you need to look for. Or guess what? We're having greater flooding than we used to have. So here's how to protect yourself from flood. Don't get into the argument about whether it's climate caused. Just deal with the actual effect. And as soon as you start telling people, and this is terrible because I don't have kids, so I totally take advantage of that whole kid thing and be like, do you want your child to get sick? Do you want your child are you worried about your child not being able to go outside and play because of air quality? And people are like, oh my gosh, my children, my grandchildren, my nieces, my nephews. And that's how you get them engaged.
Yeah, great comments, Shasta. I think health is a great way to like bring us together on this issue, whether you're talking about climate change or not. Everybody wants clean water, clean air, a good environment for their generations ahead of us to have, and focus it that way.
Well, folks, I'm going to encourage you. So I see some questions here about where to go for resources. Yeah, I think state and federal agencies more and more are providing help in a few ways, assistance. So you got grants. We're going to talk about grants later. So make sure you come to the how to get dollars for adaptation session. We're going to talk a little bit more about it. I'm actually going to share a draft database we created with 180 potential programs that tribes may be able to access that are related to both clean energy and climate change. So stay tuned. And then technical assistance. And so if you stick around to the end of the day, we're going to have a bunch of folks that are providing technical assistance. And so, there's a lot of ways to get help along with all these tools, along with all these guidances. And I think you're right. It's tough. So come to lunch where we're going to nerd out and you're going to dive a little deeper into some of these resources and ask all the questions you want. So yeah, and I think it's on some of us, right? Some of us at this level who are trying to build capacity to think it through all the way to the point where it's actually easy to use. That's the trick. Sometimes we create a lot of stuff, but it's not easy enough to use. It's still confusing or it's scattered in 1,000 directions. So we're all working on it. I really appreciate all the comments in the chat. Let's go ahead and say our thank you to our panelists on this session. We really appreciate your comments and all your insights and all the work you're doing with tribes around the country. Let's go ahead. I think we have a break scheduled.